Hi, Margot.
Hi.
My name is Jill Perez Henderson. I'm a student of physical therapy assisting at South University, and today I'm going to take some measurements of your hips and knees along with doing some manual muscle testing. Is that okay?
Yes, ma'am.
Awesome. Let's get started. So the first thing we're going to do is measure the range of motion for your hip flexion with this goniometer. So what I'm going to do is first assess your range of motion with passive range of motion, which is me helping you see how far your hip can flex. And I'm going to know we've reached that end range of motion when I feel a anterior pelvic tilt. And then I'm going to place the goniometer with the axis over the greater trochanter of the femur and our stationary arm along the midline of the pelvis and the trunk. And then our moving arm is going to go down the midline of the femur and the lateral epicondyle of the knee. So we are going to go into our full range of motion and place our goniometer. Which gives us our full range of motion of 120 degrees in hip flexion. All right, Margot, now we're going to measure for your hip extension with our goniometer, and our landmarks are going to be the same as hip flexion, which have the axis over the greater trochanter, the stationary arm going down the mid-axillary portion of the pelvis and trunk, and the moving arm down the midline of the femur and lateral trochanter. So we're going to find your passive range of motion for hip flexion, making sure the leg stays straight. And we're going to see where you can hold it in position. Very good. Now we're going to align our goniometer. Okay. I'll help you. Okay. Thank you. Which gives us our full range of motion of 30 degrees for our hip extension. All right, now we're going to measure for Margot's internal and external hip rotation. To do that, we're going to start with internal rotation, and we're going to have our goniometer alignments with our axis over the mid-patella, the moving arm down the tibial crest, and in between the medial and lateral malleoli, and our stationary arm is going to be perpendicular to the floor. So to find the end range of motion, we are going to passively move her into internal rotation, and we can feel that we're at that end range of motion because the iliac crest will rise or rock, and you can feel that. Can you hold that position for me? Mm-hmm. Okay, we're going to, let's put your trunk straight up. Okay, let's hold it. 1, 2, 3. Hold that position. We're gonna align our goniometer. Okay. And we end up with the end range of motion for hip internal rotation of 35 degrees. Now we're gonna do external rotation. So the Margot's still going to be short sitting, and our goniometer alignments are going to be the same as internal rotation, with our axis over the mid-patella, the moving arm traveling down between the medial and lateral malleoli, and the stationary arm perpendicular to the floor. So to move into external rotation, we are going to move our leg in this way. Ideally, you would be able to have an opening under the table where we can move the other leg back to give full room. We will make shift, and so you also feel for the rocking or the rising and the iliac crest to find the end range of motion. So we're going to do that. Okay, can you hold that position for me? Okay, so we are going to align our goniometer. Okay. Which gives us an end range of motion of 30 degrees for hip external rotation. Now we're going to do our goniometer testing for the knee joint. So first, we are going to measure for Margot's knee flexion, and we're going to have her supine. And we are going to align our goniometer with our axis over the lateral epicondyle of the knee, and the moving arm aligned with the lateral malleoli, and the stationary arm down the lateral portion of the femur. So we're going to move Margot into her full range of knee flexion and align our goniometer. Okay. Which is going to give us a reading of 138 degrees of knee flexion. Now we're going to measure for knee extension. Margot is still going to stay supine, and we are going to prop her leg up under the ankle to make sure that we have ample room for the knee to move into its full range of motion and extension. Our goniometer landmarks are going to be the same as flexion, with our axis over the lateral epicondyle of the knee, our moving arm down the lateral, traveling to the lateral malleoli, and the stationary arm down the lateral femur. So we're going to find our full range of motion and knee extension. We're going to align our goni. Which gives us a reading of 0 degrees for knee extension. All right, welcome back, Margot. Now we'll be testing for the muscle strength of your hips and knees. Is that okay? Mm-hmm. All right, so now we're going to start with a grade 5 hip flex manual muscle test. So we are going to have the patient in short sitting. We're going to test her right lower extremity. And I'm going to stabilize right on the iliac crest to make sure the trunk doesn't compensate during the hip flexion. And I'm going to palpate for the psoas major and iliacus while she flexes her hip in active range of motion. Can you flex for me? Okay. So now I'm going to have you do that action again while I apply force down on your knee, okay? Do not let me push your knee down, okay? So on the count.
I go to gymnastics.
Yes, she does. So she has strong hips and knees. All right, so we're going to count of 3. We're going to push down on that knee, okay? 1, 2, 3. Bring it up. Don't let me push it down. Higher, higher. Okay, and I can't break that, so that is a grade 5 for hip flexion of the right leg. Of the right hips.
Wrong side.
So now you're going to test Margot in a gravity minimized position for a grade 2 in hip flexion in the left extremity, in the left hip. So we're going to have you lay down on your side, on your right side. Okay. Lay down on your right side while I support Margot's right. You can bend it if you want, so you don't pull your hamstrings. Okay, so I'm going to support this, and I need you to bring your knee to your chest again, okay? Okay, Margot can complete that full range of motion, so that is going to be a grade 2 for gravity minimized muscle testing of the hip flexors. All right, Margot, now we're going to test for a grade 5 in hip extension. So the patient is going to be laying prone on the table, and we are going to stabilize over the pelvis right here. And can you extend this the left hip for me? Well, I palpate the glute max. Thank you. Now we're going to do that again, and I'm going to apply resistance right over your right above your knee. Okay? Don't let me push your leg down. Okay? On the count of 3, 1, 2, 3. Extend that hip. Apply pressure. Okay, I can't break that, so that is a grade 5 for hip extension. Now we're going to test for a grade 2 in hip extension. So we're going to have you roll onto your side. Okay, and we are going to test the right hip for this one. It's similar to hip flexion, where I'm going to be lifting and supporting the leg that we're not testing. And so I'm going to lift up your left leg, and I'm going to have you pull your leg back and your hip back into extension, okay? Hold on, let's stabilize your leg. Can you straighten up your trunk? Okay, we're gonna straighten up like this. Perfect. Okay, so now I'm going to lift that leg, and can you slide your leg back into hip extension? Okay, Margo can complete that range of motion. Thank you. So that's going to be a grade 2 for hip extension in the right hip. So now we're going to test for grade 5 in hip internal rotation. So Margo is short sitting, and I'm going to stabilize over the iliac crest and palpate the tensor fascia lata while you move into internal rotation by twisting your lower leg out this way, okay? So I'm gonna palpate that muscle. Can you twist? Let's stabilize, let's keep this one still, and then move that one outwards. Okay, so I can palpate for that. Now I'm going to apply my resistance down onto the ankle. Don't let me push your leg in, okay? So on the count of 3, let's sit up straight, straighten the trunk. Okay, I'm gonna stabilize right there, and then move your leg out into hip internal rotation. Okay, on the count of 3, 1, 2, 3, don't let me break it. All right, and that's a grade 5 for hip internal rotation. Now, Margo, I'm gonna have you lay down right there on your stomach. Perfect. Okay, let's scoot back just a little bit. Right here. And let's turn around. Let's actually have your head facing this way, okay? Now I'm gonna test for the left hip for a grade 2 of hip internal rotation in a gravity minimized position. We have the patient in supine. Can you scoot a little bit closer to the edge of the bed for me? Thank you, baby. Okay, and I'm just gonna have, I'm gonna roll Margo's leg out, and I'm gonna have you return it back into the center position, okay? So roll your knee back in. All right, so she has now completed the range of motion for hip internal rotation in a gravity minimized position, grade 2. And that is the hip internal rotation on the left side. All right, now we're going to be testing for hip external rotation. This is going to be for a grade 5 on the right hip. So we're going to have the patient short sitting again, and I'm going to stabilize the pelvis and the iliac crest. And we're going to, I'm going to palpate for the piriformis and have Margo actively move into hip external rotation, which is actually going to put this leg this way over. So ideally, we'd like to have an open space where we can push this leg further back to allow for more space. But just go from this and then bring it back in, okay? Bring your ankle back in. Okay, so I can palpate that piriformis. Now I'm going to stabilize again and bring that in. Let's lift them up. Bring it in. Nope. Let's stabilize just like that. Right here. Right there. Okay, and then bring that leg in. I'm going to push down on the ankle. Don't let me push your leg out, okay? 1, 2, 3. Okay, I can't break that position, so that is a grade 5 of hip external rotation in the right hip. So now we're going to have you lay down again with your head facing this way to test for grade 2 gravity minimized hip external rotation of the left limb. Can you lay down for me? Your head this way? Other way, baby. Okay. So we are going to place the other leg that we're not testing. We're gonna, okay, let's straighten up, okay? We're going to place this one out so you have plenty of room. Let's make sure your hips are straight. Okay, now I'm going to roll your leg in, and I need you to roll it back out, okay? So that, and I'm gonna palpate for the piriformis while you move back out into external rotation. Let's do that movement one more time. All right, and so that is a grade 2 of gravity minimized hip flexion for the left hip. Okay, now we're going to test Margo's knee flexors. we're going to test for a grade 5 in the left knee. So we have Margot, the patient, in a prone position, and we are going to stabilize over the pelvis while we palpate for the hamstrings and while Margot puts her leg in flexion for me. Can you flex that knee? Okay. All right, so I can palpate those hamstrings. Now I'm going to continue stabilizing over the pelvis. When I put Margot's knee in a 90-degree flexion and keeping it there. Margot, hold that while I try to pull your leg on the posterior side of your ankle and straighten that leg out, okay? Don't let me straighten it. On the count of 3, 1, 2, 3. Okay, she was able to hold that resistance, so that's going to be a grade 5 for knee flexion. Now we're going to test for a grade 2 gravity minimized knee flexion. We're going to have Margot turn on to the side lying position, and we're going to test the right knee. So I'm going to support the untested leg, lift that up, and then I'm going to have Margot move into a flexion position. Usually you would want to have a towel or something to decrease friction, and so the limb can move into its full range of motion as smoothly as possible. So on the count of 3, I'm going to have you move your leg back and see how far you can flex it, okay? 1, 2, 3. Flex that, okay? She can complete the full range of motion, so that is going to be a grade 2 in gravity minimized hip knee flexion in the right leg. All right, so now we're going to test for Margot's knee extension. For a grade 5, we're going to have Margot short sitting, and we're going to test the left knee. So with Margot short sitting, we are going to stabilize over the pelvis, and I'm going to palpate for the quadriceps. So can you move your leg and straighten your leg for me? Okay, straighten it one more time. Perfect. So I can palpate that. So to avoid the lockout mechanism of the knee, when we test for extension, we are going to flex it about 10 to 20 degrees. Okay, so we're going to flex it like that. Let's stabilize our trunk. Okay, I'm going to palpate right there. So with Margot's leg flexed about 10 to 20 degrees, I'm going to have you keep it there, and I'm going to apply force down on your ankle trying to flex it. Don't let me push it in, okay?
I go to the next.
Okay, 1, 2, 3. I'm going to push down. Don't let me break that position, okay? Let's sit up. 1, 2, 3. Oh, okay. Let's keep it flexed because you don't want it to lock, okay? 1, 2, 3. Keep it. All right, Margot was able to keep that resistance, so that is going to be a grade 5 for knee extension in the left knee. So now we're going to test for a grade 2 gravity minimized position in the right knee for a knee extension. All right, so the patient is going to be in the side lying position. Can you lie on your side for me? Lie on this leg, okay? And we are going to be testing the right leg, so I'm going to support the left. All right. We're also going to have a towel or something to ease the movement on the table and avoid friction in this test as well. But for now, our surface works. So we're going to have you lay flat, and let's straighten out your, let's move this body back a little bit. Right there. Okay, lay on your side. All right, so now I'm going to lift this leg, and I'm going to have you, I'm going to put your knee in flex position of 90 degrees, and I'm going to have you move that leg back out into an extended position on the count of 3, okay? Yes, just straighten your leg for me. Okay, 1, 2, 3. Okay, Margot was able to complete that range of motion and knee extension for a grade 2 of manual muscle testing in the left knee, or the right knee extensors.